All right. My first question then is, has our understanding on how susceptible kidney disease patients are to negative COVID-19 outcomes changed since March when the virus first became part of our daily lives?
Yeah. Well, two things. First, we know that chronic kidney disease patients, including dialysis patients, are more likely to become infected. And we know that if infected, they have a substantially worse prognosis than people without kidney disease. And much of that understanding has come after the recent outbreaks, so that we've had a chance to look at the data. They're more likely to get infected because patients with chronic kidney disease, and particularly those with end-stage kidney disease, more likely have impaired immune systems. And also because patients who are hemodialysis patients taken care of in dialysis facilities really cannot socially distance. Dialysis stations are most often less than 6 feet apart. Early on in the pandemic, there was a report out of England from West London that said that 20% of their dialysis patients became infected with COVID-19, and their work looking at who they were showed that it tended to be in certain shifts and related to distance. And so it did appear in West London that patients who did not socially distance got infected. But here in the United States, after the very stringent means were taken by dialysis units to have universal masking, to have screening of all staff and dialysis patients before they come into the unit, and for PPE to be carefully used, and for the cleaning of surfaces and machines to be done carefully. After all those things were done, there's virtually no evidence of spread of infection in dialysis units right now. So number one, they're more susceptible to get infected. But second, if infected, the likelihood of a poor outcome is substantially more for patients with chronic kidney disease. First of all, because they often have the comorbidities that have been associated with bad outcomes: diabetes, hypertension, cardiovascular disease, obesity. That together with chronic kidney disease makes them much more likely to have a bad outcome. A recent study showed that if you look at COVID-19 infected patients and compare those with chronic kidney disease to those who have no kidney disease, that patients with chronic kidney disease have a 4-fold higher likelihood of not surviving than people without chronic kidney disease. So chronic kidney disease, we've learned, is a very high-risk factor. And finally, there are some studies now looking at dialysis patients that suggest that if they're sick enough to be hospitalized, that 1 out of 3 will not survive the hospitalization. So we've learned a lot about chronic kidney disease and this infection, and it's really a disturbing picture.
Okay. Now, does the fact that some of the spread has been curtailed, does that lead credence to the theory that viral load is such a big part of this, and if we're all wearing masks and social distancing better, some of the outcomes that would go from negative to less severe?
Yeah, I mean, there are loads of theories that would, hypotheses that you can pose. That's one of them, Ken. And I'm not sure if that's right. My suspicion is it is. There are no data I'm aware of that support that particular explanation. But the fact of the matter is that taken all together, the means that have been used, the screening, the universal masking, the great care with PPE, also moving patients with known disease or suspected disease to separate shifts or separate dialysis facilities. All of those aggressive means have made a clear and very substantial improvement in the likelihood of transmission.